Good morning. My name is Yulia and welcome back to my channel, Nerdy NP Car Chat. Today we'll be talking about the difference between right-sided and left-sided heart failure. So essentially, we first need to understand how blood flows. So we have the venous circulation. So we have the superior and inferior vena cava. The superior vena cava collects blood from the head and neck region that drains into the right atrium, and the inferior vena cava drains blood from the lower half of the body, the abdomen, all the liver, kidneys, and then that also drains into the right atrium. From there, the blood will go into the right ventricle, and then from there into the pulmonary circulation where it will get oxygenated, and then into the left atrium, left ventricle, and out to the aorta and the rest of the body, and the cycle will start all over again. So things that can cause right-sided heart failure are things like pulmonary hypertension, which is an increased pressure in the lungs. This can be a result of like a chronic lung condition such as COPD or sleep apnea, which can cause increased pressure in the lung. Additionally, other things like chronic thromboembolic disease, such as, chronic PE, pulmonary embolism, can cause higher pressure in the lung. All of these things essentially put strain on the right side of the heart. And as a result, the heart has to pump harder to overcome this high pressure in the lungs. And so the right side essentially fails and the blood backs up into the venous system. So if it backs up into, let's say, the superior vena cava, then it will back up into the neck region, the head region, and so you will see that jugular venous distension, JVD, that you hear often referred to. Additionally, if it backs up into the inferior vena cava, then you will see this blood going back into your lower extremities, so you will see lower extremity edema. Additionally, you will see things like hepatomegaly, congestion in the hepatic vasculature, and this is because all that blood is backing up from the right side into the abdomen, into the abdominal organs, the liver. And so oftentimes people will complain of things like bloating, people will complain of like not wanting to eat, people will complain of abdominal pain, and this is all because of that kind of congestion in the abdomen from that blood backing up. Additionally, lower extremity edema, obviously people will have really swollen legs. And so those are the typical symptoms that we hear with right-sided heart failure. In contrast, left-sided heart failure is basically the left ventricle failing, right? It's not able to pump blood out. And so this can happen for numerous reasons. One, for instance, people with high blood pressure, uncontrolled hypertension over time, what happens is you have such a high afterload, such a high resistance in the aorta, in the arteries, that the left side of the heart gets thicker, hypertrophies, it gets weaker because it has to pump against this higher pressure. And so essentially it just can't handle it. And so it fails, and then that blood will back up. Now, where will it back up to? So as opposed to the right side where it backs up into the venous system and peripheral circulation, the left side will back up into the lungs. And so oftentimes people with left-sided heart failure will complain of things like shortness of breath, especially with exertion, especially when they're laying flat, which is orthopnea. They will have crackles in the lungs. They will have low oxygen saturation. So that's primarily what we see. But other causes of left-sided heart failure could be things like myocardial infarction, which is a heart attack. Essentially damages a part of the heart muscle, so it can't pump as hard, and that way, essentially just all results in the same outcome, which is blood backing up into the lungs and people having shortness of breath, orthopnea, things like that. So the outcome of left-sided and right-sided heart failure is essentially all the same. The heart is not able to meet the demands of the body, and we can end up with multi-system organ failure, decreased perfusion of vital organs because the cardiac output is not sufficient enough to sustain life. So in the next episode, we will be talking about the specific interventions and treatment options for left-sided and right-sided heart failure. So I hope you join me in the next episode, and I can't wait. Have a good day.